Workers navigating COVID-19 vaccine requirements are at a crossroads. That's because receiving an exemption to a vaccine mandate likely depends on your employer. Brock Turner has the story.
Tracy Staley is losing patience.
I had always intended on making a career at IU Health. I was proud for who I worked for. I love my job, and the direction that they're going is disgusting. I mean, it's not something that a lot of us want to see.
Most health facilities accepting money from the Centers for Medicare and Medicaid Services are required to have a plan for staff vaccination. Providers generally offer exemptions for those requesting them.
I've had a religious exemption for the flu shot vaccine since I started in 2015. This was the first company that I ever had to apply for one because it was the first one that mandated.
Staley, who also has a religious exemption for the COVID-19 vaccine, has become an advocate for others who haven't been as successful gaining exemptions. She maintains a website that provides resources for those seeking them. According to internal documents obtained by WFIU and WTIU News, Indiana's largest health system, IU Health, has granted exemptions to more than 1 in 12 employees. A spokesperson declined a request for an interview, but wrote the organization has, quote, given more religious exemptions than medical. Medical exemptions are reviewed by medical personnel and follow the product information sheet for the vaccine. The science allows us to be clear on the decision. Religious exemptions are reviewed differently. Employees make exemption requests based on sincerely held religious beliefs, and their beliefs are honored, end quote. But receiving an exemption could depend solely on one's employer. Micah Beckwith is the campus pastor at Life Church in Noblesville. Beckwith says he has helped hundreds of Hoosiers apply for religious exemptions and has seen significant variation. Often, he cites 1 Corinthians chapter 6, verses 19 and 20, which states the body is a temple that should be honored. Multiple sources say IU Health has been generally accommodating, but other health systems have taken a different approach. Beckwith is a member of the Republican Party who made an unsuccessful bid for a congressional seat in 2020. He continues to help those seeking exemptions.
I have not heard one person, and I've had a lot of them reach back out to me, one person that I know of that's gotten approved for a religious exemption at Ascension, and then other people who I haven't helped, just in conversation, that have filed for religious exemption, they've also said that they're getting denied as well. So,
while experts say safeguards such as vaccine mandates are both constitutional and common, wide variation among private employers is to be expected.
They could decide to be very, light touch when it comes to reviewing people's requests. Or they could decide to have a higher standard, again, so long as they weren't discriminating.
But that quickly becomes complicated. Garnett says courts haven't adopted a definition for what discrimination is in this arena, at least not yet.
It would make life easier if there were a line or a litmus test. There isn't. If we're talking about government agencies, and this is true in federal law and all kinds of contexts, you can ask about sincerity and the kinds of investigations that might involve. Again, there isn't going to be one right answer here.
The vast majority of IU Health employees have been vaccinated. Still, Staley, who works in a non-clinical role, believes the treatment she and other unvaccinated workers receive is discriminatory.
They're not respecting their employers' or employees' rights. And a lot of that, unfortunately, comes from funding, and they've prioritized that over their employees. It's really sickening the direction that healthcare and employment in general has taken.
Staley believes workers, regardless of their vaccination status, should be more valued by their employers. Both she and Beckwith agreed the politicization of the issue surprised them.
I think the biggest thing is we've got to stop looking at the sides and picking sides and saying that person's evil because they don't wear masks, they haven't gotten vaccinated, or that person's evil because they have gotten vaccinated, or they are wearing a mask. I think there's very clear lines of right and wrong, and we can certainly call out right and wrong. I'm not saying don't have principles.
3 safe, effective, and approved vaccines are available, yet almost half of eligible Hoosiers remain unvaccinated. For Indiana News Desk, I'm Brock Turner.